Hello, good afternoon to everyone.
Good afternoon, sir.
Chitra ma'am, we are ready. Can we start? Okay, ma'am. Okay.
Yes, Adrian.
Yes, sir. Yes, sir.
Thank you, Adrian. Good evening to all. On behalf of Nanda College of Physiotherapy and Department of Neurology, I would like to welcome our chief guest, Dr. Amit sir, Anup sir, and Little Seed team. Thank you, sir, for accepting our invitation once again. We had a wonderful practical section with Amit sir in an earlier webinar. It's our pleasure to welcome you again, sir, for this interesting topic. Welcome you, sir. Next, I welcome our management team and our beloved principal, sir. And also, I would like to thank for your evergreen motivation and support, sir. I welcome you, sir. I welcome all HOD, staffs, and students. Happily, I welcome all physiotherapists joined here for this webinar. Once again, I welcome you all and happy learning.
Thank you, Adrian. A warm good evening to one and all present here. Thank you, Chitra ma'am, for giving me this opportunity to give away chief guest profile. On the behalf of Nanda College of Physiotherapy and Neuro Department, I would like to thank our management principal, sir, accepted to conduct this webinar on this day. It's a great honor for me to introduce and welcome the chief guest of this beautiful evening, Dr. Amit Barova, sir. He is a certified sensory integration therapist from University of California. He also certified advanced NDT therapist. He certified OPT level 1 and 2 therapist, and also he certified autism movement therapist from USA. Apart from the studies, he also have a leadership role He is the director of Little Seeds Clinic. He is also a president of Chhattisgarh Pediatric Physiotherapist Association. Not only in leadership role, he also serving towards a pediatric world with amazing facts. He received a Best Pediatric Physiotherapist at Raipur by Raipur Lifestyle magazine. He also received a Best Young Clinical Practitioner by Haryana Chartered Association of Physiotherapists. We all have gathered here today to attend this workshop based on to enhance the practical skills. Closing the speech, I hope everyone is well aware of the theme concerning the workshop. We had a great time having you all. To conclude, I wish you all the great success in your pursuits. Thank you all.
Thank you, Adrian. Respected resource person, Dr. Amit Baurua, Director of Little Seeds, Chhattisgarh. Organizers of today's webinar, Dr. Chitra Devi, HOD Neuro Department. Supporting team members, Dr. Janani, Dr. Liji Martina, Dr. Nivedita, Dr. Satyanarayanan, all HODs, faculties, participants from various places, and my dear students. Good evening to one and all. It gives me an immense pleasure to have Dr. Amit sir once again for today's webinar on Oro Motor developmental issues in CP children. I take this opportunity to extend my sincere thanks to our resource person for always extend his great support to Nanda. Last month, he conducted 2 days wonderful webinar cum workshop that was overwhelming response from all the participants. In continuation of that, today we are inviting once again for this webinar. No doubt, today also it will be a very interesting one. I request all the participants utilize this program. I take this opportunity and his supporting team members for organizing this wonderful webinar. Thank you one and all for giving this wonderful opportunity. Happy learning. Have a great time. Thank you.
Thank you, Adrian. Thank you so much again having me. It's my pleasure and all gratitude to all the team members, especially to the principal sir, Chitra ma'am, Jani ma'am, Martina ma'am, Dr. Nivedita, and Satyanarayan sir. And thank you all these students also for arranging all these things, especially for this particular time. And all these kind words which sir has said just now, and also from the ma'am, it means a lot for me and for my team. I'm really thankful, and it's my heartfelt gratitude to all of you on behalf of all the team of Little Seeds. Related with today's workshop, I hope I'm audible as well as visible too, because everything it's more kind of practical oriented, but again it's in front of camera, so sometimes like the technical issues are there. If it is, then definitely just give me a feedback if I am not audible, or maybe if it is any issue in terms of presentation. So it's my request, as Adrian is leading everything, so I request him also. So if anything, if it is related with the audio or the video, please let me know. Am I audible and clear? Everything is? Okay, thank you. So like for today workshop, it's webinar, we are more talking about the Oro Motor things. So like last time we have discussed so many things about the posture and the technique for the transitions, technique for the control. Today we are more focused about the Oro Motor thing. So I think if we are talking about the kids with cerebral palsy, and I think there are many parents who are having kids with a special need, whatever technique I am going to teach you today, it's not only for the kids with cerebral palsy, but even you can use it for the kids with other neurodevelopmental issues, maybe for the autism also, because these techniques which I am going to teach you, it's specifically meant for these kind of population, especially the kids who are having any kind of oromotor developmental issues. Even so, the common problem in kids with cerebral palsy, I think the most commonest thing, it's drooling, excessive salivation. So there are many things which is like the chewing part, the swallowing part, the drinking, the way they are drinking, the kids with cerebral palsy. I think they need kind of food, but I think this is our duty as a therapist to guide the parents how we can improve. Sometimes the parents are just giving feedback. It take me around 2 hours, 3 hours just to feed them, and after that I'm not able to do any other things like maybe the exercises also which we are giving. So if we can improve their quality of feeding, if we can improve the time, and if we can give them, so just imagine if you are in a position where you are not happy to chew or swallow anything, but still if I'm pushing a spoon or something like that in your mouth and you have to swallow, I think it's really 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 difficult to manage. And that's how the kids are either overshooting, sometimes they are pushing you back, or they are crying, or they don't want to eat properly. So there are many problems which is going on. So I'm just starting my presentation now. Let me know whether I'm visible or not. Is it visible? Okay. Okay. So we are talking about the Oro Motor development. So the thing, it's actually there are so many things which is going on simultaneously, like the neck control, like the rolling, like the sensory development, like the Oro Motor development. So that's how just imagine a kid who is like in a prone position or on his tummy, and that's how the rolling has started, or that's how the neck control has started, because whenever they are in prone position, so just to clear the airway for proper breathing, they are just rotating their head here and there, and that's how they are rubbing their oral surfaces on the mat or maybe over the bed sheets, and they are just rubbing here and there, and that's how they desensitize their oral cavity or the lips or the structure of oromotor thing. So but if they are not having good motor control, or they are unable to move their head, so definitely they may develop some kind of sensory developmental issues also related with their oral cavity. There are many kids with autism. They have huge sensory developmental issues in terms of chewing, in terms of sucking, in terms of blowing. I think if we are assessing any kids, and if whenever we are like asking the parents, are they able to do the brushing? Are they able to do the spit out after brushing? Are they able to suck from the sipper? I think most of the time the answer is no, because the mechanism is it's need lots of skillful movement, and they have both the component, the sensory as well as the motor developmental issues. Even for the speech, believe me, if a child is like on a semi-solid kind of food, or if they are just grinding and feeding them and they are not able to chew anything in terms of solid food, I think the speech development is not possible, because that's how the mechanism at particular age, like the 6 month or 7 month kids started to have some kind of pureed or some kind of very semi-solid kind of things, and then how after by the month of 8 or 9 they started to eat some kind of little more thick, and by the 1 year or 12 months of age, they started to chew the proper solid food, and that's how the speech muscles start working, and they are able to, if someone is coming to me like related with any kind of neurodevelopmental disorder, and they are asking that the child is not able to speak out, and then how I never ask directly that what words they can speak or what they are not able to, but I always ask, are they able to chew properly, are they are taking their food, what they are prefer to take. I think most of the time the answer is mostly it's either they swallow it or the semi-solid or any kind of liquid only they can take. That's the first indication for me that they are not able to chew properly. That's how the speech muscles or the mechanism which required for the speech production is not very good. So if we are talking about the cerebral palsy, I think many factors are involved. Definitely the motor, definitely the sensory, and the mechanism which require different coordination of different muscles to chew, to suck, to swallow. So that kind of coordinated mechanism, which is very important, I think it's not very well developed. The other thing why there is oromotor issues in kids with cerebral palsy, I think most of the time if we are going to assess their tongue position, either it's protruded or very well retracted, because like in kids with spastic cerebral palsy, most of the time they are using their tongue in a protruded position just to hold that position in terms of to prevent the fall. Like if I'm asking them to hold a ring or hold a toy or come to the mama or hold some anything, any activity, if you ask them to do that, I think they are using their tongue to just hold that position, because they are using their diaphragm most of the time as a postural muscles more than a respiratory muscle. Diaphragm, it's a muscle which is really involved in kids with any kind of neurodevelopmental issue, mostly in kids with cerebral palsy, because they are using the second component of diaphragm, that is for the postural stability. They are not using mainly for the respiration, but they are mainly using to control their posture, because the trunk control or the postural control is very affected in kids with cerebral palsy. So that's how they are using their tongue, their jaw, their lips for the stability, not for the feeding, not for the speech production. There are some other issues also, like the trunk control, the neck control. If just imagine if my neck control is not very good and I'm just leaning forward, I'm not looking up, definitely my mechanism, like if I will ask you as a normal person, if I ask you to chew something, a piece of apple in a flex neck position or in a slouch or kyphotic position, I think the most difficult part which you can't do very easily. So that's how the kids with cerebral palsy, they are feeling that particular fear, anxiety, even for taking one spoon of food. Or it's really, believe me, sometimes it's feel helpless actually, because whenever I'm watching some parents, they are just pushing a spoon of food just to finish the work of feeding, because it's very difficult for parents to understand which position is important. So for today workshop, for my goal, it's I'm not sure how many therapists want to do use all these techniques, because it's more kind of clinical practice. But I think whoever is listening me today, I don't know each and everyone, maybe some other professionals are also related. But for this workshop, I think for this particular webinar, I think the main goal for me is to teach you how you can teach some parents so that they can do it in a proper way with their kids, and then kids will understand that feeding is not a painful phenomena, but it's a most important part of their life. They have to feel it, they have to taste it, they have to enjoy their meal time, not as a punishment, but they have to enjoy it, just to enjoy and explore different tastes, different items in the food. So that's my main goal for today webinar. Related with oral mechanism or oral development, I think lots of things are involved: the lips, the tongue, the jaw, the teeth. So just imagine when whoever has treated a child with dystonia, most of the time either the mouth is wide open or very tightly closed. because they can't control anything in a mid-range, and the chewing mechanism required lots of control in a mid-range. And whenever there is a mid-range problem, either they are overshooting with, they are using their jaw like and that kind of things, or they are using their tongue in a retracted position in cases of dystonic cerebral palsy. So that's how it's very, very important to teach them a correct position, to teach them to give them a sense of correct position, so that they can understand and they can continue practice it, and then how it's become for them to be more comfortable in that particular position. So there are different structures which is involved in oral development and oral mechanism, the lips, tongue, jaw, and also the trunk control. Before starting anything, any technique, one thing which is very important for me, like last webinar also, I was very stressed on that particular point. The alignment or the position is very, very important. So in between, I will teach you techniques, and in between, if times allow, I will show you some video also how we are doing on our kids with cerebral palsy. But the one thing which is very important, it's about the position before starting any technique. So the position may be a supported sitting, the position may be on CP chair, the position may require the neck collar, which I already taught you last webinar. So the position is first, which is very, very important. Today, whatever technique I am teaching you, it's called oral placement therapy, or the OPT, which I have done my certification, which already Janani ma'am has explained about me. That's I have done with this particular certification, which teach you how it is important to teach a child. And these techniques, believe me, you can use in any kids, or even the patients with hemiplegic, adult hemiplegia actually. So this particular technique it's not very old, but it is very, very, very structured. Means how many times, how to do this, how to do that, very well structured. That's what I really like this particular technique. And in my experience, I think even in severe cases, we get result within 1 month if the parents are also practicing in the same way at home. So this is very so like for example, if I'm teaching a child in a traditional way, so like if I will say, look at me, what I am doing, do the same thing like ma, ba, or close your mouth, open your mouth, or show me your tongue. That's more kind of auditory and visual approaches. Look at me, listen me, that's more kind of. But this particular technique, the OPT, it's based on proprioceptive inputs or the proprioception, because we are using some equipment. So that's how this is very, very different. And what about me, like, as I am not a speech therapist, but whenever I am teaching any child or any parents, I am dealing with this particular technique. Difference from the speech therapist also, or there is a feedback from the parents. Now he's able to say some words like ma, ba, whatever, because that position, because I already said, if you are giving any child a grinded food or some kind of very semi-solid, and if they are not able to chew properly, I think the speech is not going to develop in a correct way, or the pronunciation is not very clear. So that's how the feedback. So just there is a one example, like if I'm asking you to close your lips, it's more kind of auditory. If I'm showing you, look at me and do that, it's more kind of visual things. Am I audible? Is it okay now? Because I'm going toward the technique, so I really want everything should be very clear.
Yes, sir, you're audible, sir.
Okay, thank you. And so the last line, they are talking about if I'm just putting this kind of a stick, ice cream stick or any kind of tongue depressor, if I will ask the child to hold this, then it's more kind of proprioceptive input that they have to hold this particular, and then how they have to like it's more kind of auditory, visual, as well as proprioceptive things. The goal of any technique which I'm going to teach you, it's definitely for the kids to increase the awareness, because they don't know how to do that. So if just imagine if kids with cerebral palsy, spastic cerebral palsy, if I am asking close your mouth, but still they are not very aware, they are not looking to you, and they are not aware how to do that. So that's the first thing I think we have to increase the awareness what we are talking. So like sometimes we are asking them, hold the glass, lift your right hand, but still they are not aware what they have to do. then the motor planning part, that how to do. So first part, definitely to increase the awareness, to improve the precision, to improve the gradation, like the particular movement, because for the chewing it's required lots of grading movement, or the dissociation. Dissociation means how to differentiate from one part to another part. So like tongue is not has to move properly, the jaw has to move properly, the posture control has to be in a good position. So everything is very, very important. So these are some goals which is really important. The common problem in kids with cerebral palsy, I think the most commonest is about the drooling or excessive salivation. I think whatever it is the case, like the GMFC is 1 to 5, somewhere the kids are having some drooling issues or the excessive salivation issues, the feeding, the speech production, as well as the gradation problem. That's what we call the motor problem. What may be the reason for drooling? I think the most commonest is about the poor posture. It's not excessive drooling actually, but they are not able to swallow it properly. That's how they are just the saliva is collected inside the mouth, and whenever they are just in a neck flex position or any position or any change in the position, that excessive accumulated saliva is just coming out. And that's the main commonest reason, I think so. And the jaw weakness, the lip weakness, and poor tongue retraction. It's very, very important for teaching them, because tongue retraction is very important to swallow anything. So just imagine you all are sitting and listening me, and I'm also talking. So there is lots of saliva which is going on, and still if you feel it, how you will swallow it, then definitely you will feel your tongue is in a backside, or it's in a retracted position. So just feel yourself to swallow your own saliva and just feel where is your tongue. So most of the kids who are like spastic cerebral palsy, they are not able to do the tongue retraction, and that's how the excessive salivation it's there, or the food is totally accumulated, or we are just pushing a spoon just to for them to understand to swallow. But I think that's not the way to teach them. So these are some component which leads to excessive drooling. These all things which we have to assess whenever a parent is having a complaint of excessive salivation with that particular child. So what's the reason? Either it's a poor posture, or the jaw is very weak, or the lip is not closing, or actually everything is there but the tongue is not retracting, which it has to go back for any kind of swallowing. The sensory problem, last time I think I have already oriented you for this particular thing. That tactile hyposensitivity means the kids are not able to feel that food item inside their oral cavity. The tactile hypersensitivity, or it's maybe the mixed. Okay, so the most important technique, it's about the brushing technique. There are different kinds of brushes are available. It's not about to purchase and to have everything in your pocket, but I think whatever the parents can afford, I think I always prefer that particular thing. So I have so many options for this particular thing, but if parents can afford, I think this blue one, this is what we call the Z Vibe actually. This is the best one, but it's costly. So I already said it's not the matter what you have, that's very important, but the correct technique is very important. So if parents can afford, this one is the best one, because it can be used for long time, even for the years actually. So that's called Z Vibe, but you can use different other options also, which I am going to teach you. So so the next part, I'm going to teach you about the brushing thing. So am I visible now?
Yes, sir.
Okay, so I'm going to teach you the brushing thing actually first. The brushing part can be used for any child, even for the autism, the Z Vibe, or the in autism we mainly use for the desensitization of oral cavity, because they usually have very limited kind of food choices, or either they are not able to chew properly. If the kids are having biting habits or they bite anyone, this technique is really useful. If kids are having excessive salivation or having lots of drool, so this technique is useful. If kids are very sensitive for any kind of particular food item or not able to swallow anything, this technique is useful. How to do that is very important. So there are different brushes which is available. If a parents can afford or can purchase a brush, we always ask them to purchase this one. This is called Z Vibe. If they are not, then definitely you can use this one. This is called Nuk brush, N-U-K, Nuk brush, which you can use. It's the cheaper one, or it's easily available on Amazon or any kind of baby product shops, which is easily available. If parents can afford it, this one. If parents can't afford, this one is easily they can. But if they can afford an expensive one, then the Z Vibe is the best one because it's having an extra sensation. That's what we call vibration. So it's having everything, like this one is having a bumsy part, and this one is having a creases, and then extra knob is there because it's a battery operated brush. That's what we call Z Vibe. Okay. Leave it. Whatever brushes they can afford, it's okay. But the technique is very important because as a therapist or as a clinician, we have to teach the parents also what to do at home. I always prefer to do these techniques before feeding because that's how, because it's a passive things, it's a sensory things which we can give to the child, and then they can chew it and they can use it as a motor component, the chewing part and the blowing part. So always it should be a combination. So whatever brushing technique I'm teaching you, I always ask the parents, or if they are not able to follow your command, you can ask them just to produce some sound. You can play with them so that they can produce some sound, so that the motor output is always important. So how to do this? So always start from outside. Whenever you are starting with some child first time, always start from outside. So if we are using anything which is new, because believe me, if kids are very severely having spasticity or any kind of dystonia, they will not allow you to put anything in their mouth. So always give them, feel them, ask them to feel it, what it is particular thing. Just sometimes touch over the face, sometimes touch over the neck, so that they can understand this is not going to harmful for them. If you directly put anything inside the mouth, they will just refuse it, or they will not allow you for the next time also. So how to start? First or most important thing about the position. So if my position is correct, then only I'm going to start any technique. If my position is not correct, or the child is not able to sustain that particular position, I will use different assistive things, maybe a pillow, maybe bolster, maybe some kind of neck towel, so that they can be in a correct position and I can work lots of oral things. So how to start? Always start from outside. So it is just kind of moving like 1, 2, 3, 4. So it is kind of arc movement. So something like this. 1, 2, 3. I'm talking about the outside movement, like above the lips or the outside of the lip. So it is kind 1, 2, 3, 4. And downside also you have to do the same thing. So it is like 1, 2, 3, 4. So it's hardly 4 to 5 movement which is required. If kids are not able to sustain their neck position, we have to give them an extra support, and then we have to do the same thing. 1, 2, 3, 4, and then 1, 2, 3, 4. This is from the outside. Then this is first step. Actually, we have to follow in the same sequence. So like if I'm teaching you the first, then I have to go on second, then third. We can't be in between in this particular technique. The second technique, it's the second step, it's about 3 rays, which is just joining toward the mouth. So we have to give them this kind of things. So it is something like this, then this, and then from down to upside. So I'm just going to show you on one paper so that you can understand in a better way. So just imagine. Is it visible? I don't think so.
Yes, sir.
Okay. So if this one is the lip structure, so if the first technique, it's about the arc movement. This one, 2, 3, 4, 5, something like this. And then downside, it's 1, 2, 3, 4, 5, something like this. So then from the cheek, so this is kind of some kind of rays which is joining toward the angle of mouth. So 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, and then from down to up. So it is something like 1, 2, 3, 4, 5. So it is kind of three direction actually. 1, 2, 3, 4, 5. Then 1, 2, 3, 4, 5. And then 1, 2, 3, 4, 5. So three rays which is just joining at the mouth level, because that's how the oral cavity has to close. Every muscle has to work, and that's how, because we are working from outside, so that we are giving sensation to the oral structure just to close the lips, because for anything swallowing or anything, the lips has to close. So that's how the first thing. The second step, now we are entering inside the mouth. Whenever we are talking about inside the mouth, I already said we have to always start from the outside and then we have to go inside. So the second thing, so like if this is the lip structure, so now it should be for the inside, it's kind of four section or four components. So like 1, 2, 3 toward the midline, corner say toward the midline, from corner to midline, this is 1. 4 to 5 movement, 1, 2, 3, 4, 5. Then the second one is also from the opposite side, so it is 1, 2, 3, 4, 5, from corner to midline. And then downside, 1, 2, 3, 4, 5, from corner to midline. And then the 1, 2, 3, 4, 5 from corner to midline. So it is something like corner to midline, corner to midline. When we started from outside, it is more kind of arc movement to complete that thing. But whenever we are doing this thing inside, it's more kind of corner to midline, corner to midline. Same thing opposite side, corner to midline, corner to midline. And same thing downside also. So it is something like, do not just move it like that. Just start from the corner and finish it, corner and finish it, corner and finish it. And that's how you have to do it on other side also. So it is having four components. So 1, and then the 2, the 3, the 4. So upper thing is 2 component, and lower also there is 2 component. Every movement has to be repeated at least 5 to 6 times. So that's so this is what the response which we'll get whenever you will give any sensation. The kids has to close their lips and they have to swallow. That's really important. Okay, the next step it's inside the cheek, something like. So how we can do this? This is kind of C movement, or this is kind of making a C inside. So inside the cheek, oral cavity, just 1, 2, 3, 4, 5, and same thing 1, 2, 3, 4, 5. So this is just inside the mouth. It's more kind of C pattern, 1, 2, 3, 4, 5, and C pattern 1, 2, 3, 4, 5. So something like this thing inside the cheek. And the last is over the tongue. That is more kind of margin, tongue margin. We have to kind of swap movement from the middle part of the tongue toward the anterior part. So it is something like just moving the brush from the margin. Do not ask the child to show me your tongue and then you started moving. No, wherever the tongue is there, then you have to move at the margin of the tongue, and that's how we have to stimulate the tongue. So this is more kind of passive actually, because we are giving an extra sensation. So whenever the kids will start have any kind of chewing or the saliva, they will feel it, and that's how they can start swallowing. And this is very important, and it's really working if you will give them, because I already said for the goal of this particular technique, it's about awareness. Whenever we use any kind of sensation, definitely the awareness is most important part which is going to be increases. Or if you are having Z vibe, or if you are using any kind of vibrating stimulation, there are many brushes which is available with the bristles also, but this is not, that particular brush is not mean for this particular technique. This technique required either, that's what we call toothy, or the Z vibe, or maybe the nug brush, or if kids are very young, then you can use the finger brush or the baby brushes, which is easily available. So anyone you can use. Even I always ask the parents who even can't afford anything, I ask them to use the napkin, a very clean napkin, and then with the finger do all these movements so that they can at least feel. If kids are very young, then definitely you can use all those things. I hope this is clear related with the brushing part. Okay. So the next, so this is how it's very important to start the brushing part. So we have to be like from outside, and if kids are very young, so this is a child who is very young having the episodes of epilepsy also. So I can't use any kind of direct vibration, so that's how I'm using a finger brush, and over that I'm putting this Z vibe, so that will give a indirect vibration to that particular child. And always we have to start in that way. Any kind of extra vibration, if we are using for first time, or if we are not very aware for particular cases, always start without vibration and then add on any kind of vibration whatever you want to use. Second technique, which is mostly used by many therapists, and even everyone is using, even they are therapists or they are not, but we all understand the bubble blowing, or it's very commonly used in any kind of therapy protocol. But if I am asking you how many times, I think most of us, we don't know how many times. So this is how the beauty of this particular technique, because it's talking about specific protocol. So bubble blowing, the second technique, everything, it's now motor component. Whatever brushing technique I taught you, it's about the sensory part, how to increase the awareness. If the awareness is more, the structure is activated, then only you can go for motor activation. So the second technique is bubble blowing. Bubble blowing, it's more talking about the abdominal gradation. That's how they have to blow. For any kind of blowing, the jaw stability is very important, lip rounding is very important, and tongue retraction. Believe me, whenever you are blowing anything, it's always the component is tongue retraction. So if in your protocol you are teaching any child for blowing bubble, you have to observe these four components: the abdominal grading, the jaw stability, the lip rounding, or tongue retraction. If anyone is not walking properly, or if it is not in a correct position, you have to reassess and you have to teach them. What about the bubble blowing? At least, what's the criteria for success, or how many times? It's the 10 repetitions without any break. That is your last goal, or that is your actual goal. Even you can use it in kids with autism, where the blowing is a huge problem because they are not understanding how to round the lips, and it's very important. What about the steps? Because the kids are not able to understand how to blow. Sometimes they are just licking it, sometimes they are not able to understand how to do that. So how to increase, how to start? Okay, I'm teaching you. I'm just starting my camera so I can teach you in a better way. So for the bubble blowing, I think how to start if kids are not able to understand how to blow, always we blow the things like first blow a bubble. A therapist is blowing a bubble, and whenever bubbles are there, we are just bursting it. We are trying to pop these bubbles over the kid's mouth or over the oral cavity. So if I'm having a bubble on my bubble straw, I ask the child to kiss it or maybe burst it. So if they are so that will give you the oral awareness, because most of the time we are asking them, okay, now blow, 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 and they are not able to understand. So always we can start these kind of things if kids are not able to understand, because that bubble busting over the lips will also give you awareness, because that's how the structure which you have to use at the time of blowing. So blow some bubbles, take it on your straw and ask them to kiss it or burst these bubbles with their lips. So that's how we can start. Even we can ask them to say ha 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 ha, so that they can understand that they have to use their abdominal muscles for blowing all these things. They have to use their expiration phase actually to understand that they have to blow. If they are some kids with spastic cerebral palsy, they are doing this. That's not the correct technique. I already have mentioned about that 4 component. The lip has to be round, the tongue has to be retracted. So everything we have to be checked. If they are not able to do it properly, we give them a position or we ask them to, okay, now say ha. So that also you can ask them to, or that's how you can initiate also, so that they can understand how to do that. So I'm just showing you one video. I think it's maybe visible. Actually, it's in Hindi, but I can explain you that what we are talking. He's a case with quadriplegic cerebral palsy and always having tongue protruded whenever he's trying to blow, and he needs extra support because he's using his shoulder, which are kind of accessory muscles. And the kids who are having problem with that particular thing, they are always using their shoulder girdle or neck muscle or any kind of accessory muscle which we not required. So that's how, if you will give them a correct position in terms of holding, in terms of neck control. So I have used a binder which is there on at his chest level, so that he understand that I have to use my abdominal muscles to blow or for the abdominal gradation. Backside also there is a lots of support, so that he will not use his head extensors, because he is having extensor thrust with him whenever you are giving him a stressful activity. But anyhow he managed and he understand. Initially when we started, he's always using his tongue just to move it out. That's what the situation initially. So I this is how we can start, but always the techniques are more important compared to the repetitions and compared to the skillful movement, but the techniques are very important. Okay, so the next thing, so this is how I already explained that either you can ask them to kiss a bubble or just pop it with their lips. You can ask them to breathe on the bubbles or blow it. You can ask them, is it visible? My slide is visible. Hello? Am I audible? My presentation, this one. Just give me a minute. Is it visible now? It's not visible. My presentation is visible. This one?
No, sir, but still sharing.
Just give me a minute. Sorry for that. Is it okay now?
it's visible, sir.
Okay.
Yes, sir.
So the bubbles blowing technique, which I already explained, it's about pop up on the lips, breathe on the bubbles. Or even sometimes we are asking them to use a straw to blow it, because that particular straw will give you an extra feedback that they have to feel it and then ask them to blow. The maximum control or the end range of this particular technique, it's about they have to blow it up to 2 feet. So sometime the training, it's about, like, if I can ask them, okay, now listen, it's more kind of a competition. I'm blowing a bubble and it's going up to my hand. What about you? You are also have to blow, and let's see where your bubble is going. Or we can put some puppets also, and we can ask them to blow up bubbles, and whose bubble is going up to that particular range. So which is very important. So the next technique which I'm going to teach you, it's about chew tube program. That is also very, very important. It is also important for the kids who are having chewing problem, who are having feeding issues. I hope now my screen is visible. No?
Sir, your presentation screen was visible, sir.
Not visible. I'm so sorry. I don't know. I am just trying my best. No. So the next technique is more about the chew tube. Chew tube, it's I don't know, but I don't know why, but the presentation is not visible to all of you. I think I have already done, but So then I'm so sorry. I don't know what's happened. Actually, that's the presentation is not showing on your screen, but I'm just showing you the techniques how to do that. So the next technique, it's about the YouTube program. The YouTube, it's we call the oral dumbbell or the oral resisted exercises. It's again a part of it's actually related with the motor component, because I already explained you whenever you are using any kind of sensory stimulation, the brushing technique or Oro Motor stimulatory technique, that's what we call, and we have to use the motor component simultaneously, either the blow or the chew tube. So chew tubes it's our oral dumbbell which are different in color. It's color coded things. So the least resistant is about the red one, and more than that it's about the yellow, and then how the blue, and then the green. So the first one or the least resistant one, it's अभी दिख रहा है presentation. Is it visible now, the presentation?
Yes, sir, it's visible, sir.
I'm so
Yes,
sorry.
sir.
I'm really sorry.
Yeah.
I'm really
It's
sorry.
okay, sir.
So I don't know what technical issues are going on. So this particular technique, it's called YouTube program. YouTube program or any kind of chewing program actually can be started in any age group, but this particular YouTubes which are using the finger brushes, and we are using that particular thing for chewing, but so that's what we call finger cuff or the finger brushes. But YouTube program, it's a gradation, or that's how I already explained the problem about the chewing in kids with cerebral palsy. They can't grade, they can't do the movement gradually for the long time. Either they will just bite but can't chew. That's what the problem. So this is very important. Even this is important for the kids who are having biting habit, like the kids with autism or ADHD. They have a huge problem with the biting others also, and even they bite their own hands. So this particular thing, specifically, this is not audible also. Ma'am, am I audible and visible? I'm so sorry. I'm asking you again and again the same thing, but I don't know what's going on there.
Sir, audible only, sir.
Audible only?
Yes, sir.
Yes, sir.
Is it okay now?
Okay, sir.
Actually, your screen is not visible, sir. So now it's visible, sir.
Thank you. So this particular tube, it's color coded actually. So this is how the clinical presentation. Whenever we are using any tube, the kids has to chew it 10 times at least. That's how the target. So there are 3 cases like client A, client B, and client C. When we are talking about these particular cases in client A, it's more look like the symmetrical involvement. In client B, it's more look like the left side is weaker than the right, and in client C it's look like right is definitely involved but the left is not. So because we are using these chew tubes and we are asking them to chew it at least 10 times, so they have to chew it 10 times right side, 10 times left side. We have to always start in a same gradation, first the red and then the yellow, then the blue, and the last one is the green. The yellow one, whenever we are using for the young kids who are around some months or maybe around 1 year, the yellow one is having actually very narrow diameter. That's how it's very important whenever we are using for the kids who are young. And how many times? Definitely it's 10 times right side, 10 times left side. This is how we have to always start. And if a kids are not able to do it properly, always give them a support. So sometimes we are supporting their neck or sometimes we are supporting their jaw, so that they are using only the jaw muscle, not the neck or shoulder muscles, which is very important. The next technique which is important, it's about the horn blowing or the blowing technique. So blowing technique, because we are always using so many whistles which is available, and even in many curriculum or in many our program, we are asking parents to teach the kids for the blowing. But I think it's very important to understand why it is important and what component it's very important. So whenever we are talking about blowing, it's always helping to reduce the drooling. It's improve the abdominal gradation. It improve the jaw stability. Also, it is very important for tongue retraction. What is the technique? Actually, whenever you are using any kind of whistles or any kind of whistles, it should have at least 2 whistles in your bag. That is one with the flat mouthpiece and one with the rounded mouthpiece, because most of the speech or the production of words, it's either the lip closer or lip rounding. So at least 2 pieces of whistles